Hey guys, this is Ryan from Tribe Labs here with your Tuesday tip on the return on investment of patient retention for physical therapy. So, as you guys might be following, one of the things that we found at Strive Labs is about 20% of patients drop out of physical therapy care in the first 3 visits from some of the analyses that we've done over time. And that's just a massive opportunity for growth for PT clinics because what it does is it costs each individual location about $125,000 to $150,000 per year that you're leaving on the table. These patients have already started PT and are dropping out, so it's directly within your control to sort of improve that. And one of the ways that you can improve that is by understanding who's at a high risk of dropping out before they drop out, and then intervening in real time and improving that experience. So essentially, one of the things that we utilize, we leverage a one-question survey early on in care called the Net Promoter. The Net Promoter question, there's tons of resources on our blog and our website on Net Promoter and its power. But the beauty of, I'll call it the NPS, is that it does a couple of things. One, it identifies your walking, talking billboards, the people who really love your practice and are advocates. But what we also know is it identifies people who are attending far less visits than people who are scoring on a higher end, and people who are at a higher risk of dropping out. So what we know is people who are scoring below a given threshold are dropping out quicker. So if we deliver this early on in care, let's say about 7 days after the initial evaluation, it hits a patient's inbox, and if that patient scores low, they now have the opportunity to leave some feedback on why they feel the way that they do. And perhaps in this case, it's, my therapist doesn't brush his teeth. So what we can do now is, as soon as somebody scores below the threshold for high risk of dropping out, we can trigger a message to the person at your organization that should be getting that message that lets them know that, hey, low score has just came across your desk. And now what you can go ahead and do is you can log straight into Strive Hub from that email. And when you log in, you're going to actually hit this page right here. And you'll be able to see, okay, it was Shirley Nutter. Shirley scored a 3. Primary therapist was Ryan Kleps at our Boston clinic. And the body part is other/unspecified, meaning the ICD-10 was something like myalgia, not otherwise specified. And her feedback is that the therapist doesn't brush his teeth. So in this case, now, this isn't simply retrospective data. The evaluation date was 4 or 5 days ago. You now have the opportunity to, in real time, decrease this person's risk of dropping out by connecting with Ryan or the clinic manager at that site and putting in a process, running essentially a process to intervene appropriately. By giving our customers this opportunity, they're able to identify issues faster with individual people who are scoring low and decrease that risk of dropping out. What we also want to do is give you the opportunity to start to understand things globally. So we take all of those Net Promoter scores over time and embed them on this really simple to understand dashboard where we'll break down the Net Promoter score for you over whatever time frame you choose, so the last 30 days or the last 90 days, and kind of display your Net Promoter score over that time, as well as the breakdown of how you got that score. But what's really powerful for our customers is not just having the recent responses displayed, but having just sort of a ranking of Net Promoter by all of their physical therapists from low to high, having a Net Promoter ranked by clinic location from low to high, and having a Net Promoter ranked by body part being treated from low to high. So when we talk about how we can improve patient retention here, it's about understanding how things are shaking out at a global level where you can look and say, hey, what's going on at the Boston clinic here? If I go into my location filter and filter down by my Boston clinic, now we're just looking at Boston data. And again, this is just the Boston scores over that time frame. Here are all of my Boston therapists. And it's pretty clear here that Ryan Kleps is the therapist who's kind of driving us down and decreasing that score. So I can come into my provider filter and say, all right, show me just Ryan Kleps' scores. And again, the whole dashboard will kind of update for you. You'll see these are just Ryan's scores. But if we come down to net promoter by the body part that's being treated, and very simply what we're doing is we're matching ICD-10 code to body part. So as your patients are flowing through, they're being attributed a body part here. And now you have the opportunity to look and see what types of cases Ryan is succeeding at and what types of cases he needs a little bit of assistance on. And this isn't necessarily in terms of efficacy of getting somebody better. It's really the lens of the customer experience. So you can start to understand that this therapist, Ryan, is not connecting with his pelvic urogenital patients or his cervical patients, but he's kicking about with his ankle and his knees. So you can sit down and have constructive conversations with him about how he's approaching one case versus the other. The idea behind it is, if you can make these into teaching moments, you're not only going to catch those poor scores in real time, you're going to be able to, over time, identify where the gaps are in your organization in terms of how you're connecting with patients and improve them over time. And when we talk ROI, we've been able to help our customers decrease their 1, 2, 3 visit dropout by 20% at some large organizations, which is really significant. When you start to look at the dollars and cents of it, a 15 location group can be recouping as much as $200,000 just by monitoring the customer experience and improving that 1, 2, 3 visit dropout percentage over time. So if you guys have any other questions about how you can utilize tools like StriveHub to decrease that early patient dropout, increase customer retention, and make your business more money, feel free to reach out to me directly, Ryan@strivelabs.com, or you can check us out on Twitter @strive_labs, and just keep on reading the blog for more tips. All right, guys. Well, until next time, we will see you soon. Bye now.